And some major changes could be coming to childhood vaccines. A health department advisory panel set to vote on ending the hepatitis B shot at birth. And they're also questioning whether ingredients in routine vaccines could be linked to rising allergies. NewsNation's weekend anchor, Anna Kooiman, she's been following this one closely for us. So, Anna, quite a bit of changes could be on the way here. What's first? What's to start?
All right, hey there. Good morning, Kelly. Good morning to everybody at home. So we could see a major shift in children's vaccines after the Advisory Committee on Immunization Practices is going to be meeting today and tomorrow. At the center today is the hepatitis B vaccination. The CDC Advisory Committee reportedly wants to address delaying when children get the Hep B shots. Now, this vaccine is 3 doses. The first one is given usually to newborns, and then the next 2 happen within 18 months. While there's no federal mandate requiring this vaccination, this schedule has been recommended since 1991. Now, some feel it is better to wait until children are older for them to get these shots. Medical professionals have mixed opinions regarding this, as we all know. So the Vaccine Integrity Project sent NewsNation a statement saying, in part, the project's independent review found there wasn't evidence to support delaying the hepatitis B vaccine at birth. They went on to say delaying the vaccine at birth increases the chances of hepatitis B infection, which could put them at risk for diseases like chronic liver disease and cirrhosis. They also said the vaccine has a, quote, strong safety profile. Well, a medical expert we spoke with is worried, though, about the vaccine's ingredients and said less than 1% of pregnant women are at risk for the disease.
It is a very niche disease in the United States, and so I would be much more in favor of a targeted campaign, which would really focus on people who are at higher risk. The CDC actually studied this and found that there was a 26% increase in the risk of developing asthma for kids who got the doses of aluminum that are in the U.S. schedule, and those doses are largely driven by hepatitis B.
Yikes. Well, according to a draft of today's agenda from the CDC's website, the committee, Kelly, is scheduled to vote later in the day. While there isn't any information about what they plan to vote on, discussions about the Hep B vaccination are the only items on today's agenda.
Wow, some big shifts here, potentially, Anna. So the Hep vaccine, this isn't the only thing the committee may modify at the same time.
Well, that's correct. So according to the agenda draft, tomorrow the committee is supposed to be discussing adjusting children's vaccine schedule. It is worth noting there aren't any plans for them to vote on this one. In the past, RFK Jr. has questioned if there is a link between vaccines and autism. It is a claim the American Academy of Pediatrics disagrees with, and they say they have the science to back it up. Kelly?
All right, we'll be watching. Anna, thank you. And you can catch Anna Kooiman every weekend at 1 p.m. Eastern. That is 12 Central Time.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.